So I'm going to pass it over now to Dr. Saad to speak about possibly some projections coming up, as I stated what Minister Calandro was hinting at.
Thank you, David. So one of my old infectious disease preceptors used to say, once you've seen one flu season, you've seen one flu season, and that's it. Because going from one flu season to another can be extremely unpredictable. They each look very different from each other. But one of the things that we do sometimes in North America is look at what did the flu season look like in the Southern Hemisphere, because oftentimes that can give us a sense of what we can expect here locally. So in the Southern Hemisphere, and particularly Australia and New Zealand, who are in their winter season right now, between April and October, you can get a sense of what influenza is, how it's circulating and how infectious it is there, and then predict what it could look like here in our winter months. This turned out to be very analogous, and we mirrored what Australia did for the last 2 or 3 years. You can see from the dotted line for 2021, that pale blue line was nearly 0. And that following winter here in North America, we had nearly 0 cases of influenza. Similarly, the 2020 line looks very low as well, and we again followed the similar pattern. What's concerning healthcare officials and providers in the Northern Hemisphere is what's happening in the Southern Hemisphere now. 2 things you'll notice from this graph is, one, their influenza season peaked very early. It started almost 1 or 2 months before it normally would circulate. And secondly, the peak of the graph is actually higher than previous influenza seasons. And the total number actually topped out more than 3 times the total number of influenza cases that they've had over the preceding 5 years. So healthcare officials are speculating as to why this could have happened. One reason, if you notice the last 2 years, there were very minimal influenza cases. And so people are saying, well, it's because the general population wasn't exposed to influenza, immunity may be very low. And as a result of the population not seeing a lot of influenza over 2 years, they're now more susceptible to influenza infections. And then the other main vector for transmission of influenza, as we've known for many years, are children. And kids are back in school. Kids are maskless this year, as which is different than the previous 2 years, and they are a primary mode of transmission. So the combination of low immunity to influenza over the last 2 years, combined with maskless children this year, is likely what contributed to the significant influenza rates in the Southern Hemisphere, and something that we are worried is going to happen locally here in the Northern Hemisphere. And that's part of the projections that we're concerned about that David was mentioning on an already strained hospital system. So number of influenza hospitalizations at Sentinel hospitals, again, from April to October over the preceding years. And you'll see the spike again, starting early and peaking early compared to the previous couple of years, where you can see almost a flat line for 2020 and a slight increase in the numbers for 2021. So those, and then of course, the other thing is both influenza and COVID are both respiratory viruses. Since the beginning of the pandemic, infectious disease experts were always warning about the possibility of 2 respiratory viruses co-circulating at the same time, which could spell trouble for hospitals, especially when they're already strained and struggling. And so that's part of the projections and what we're worried about. And you also have to remember, it's not just the respiratory illnesses, because influenza and COVID can also exacerbate ongoing health issues for many of our patients and lead to serious disease of underlying comorbidities and potentially death as well. So that's unfortunately some of the projections that we're looking for the fall.